My name is Whitney Tucker. Hi. And I'm Research Director at NC Child, and I also chair the Education and Youth Subcommittee of our State Complete Count Commission. It's been hinted at by some of our earlier speakers, but I just want to talk a little bit about the undercount of children and young children in particular, because it will have a big impact on our state. So due to many variables, children are historically one of the most undercounted populations in North Carolina. Previous years of census data have confirmed that children in low-income households, children of color, and kids living in immigrant families stand to be disproportionately undercounted, while also having the most to lose as vital programs face census-related reductions in funding. Our state's economy and our communities will ultimately suffer, and our youngest children are the most vulnerable. According to the U.S. Census Bureau, an estimated 5% of children under the age of 5 were not counted in the 2010 census. That's about 1 million young children and the highest undercount of any age group. In North Carolina, more than 25,000 young children were not counted. So children under the age of 5 now represent nearly 6% of our state's population. All of us must work together to ensure that our youngest citizens are not missed in 2020. A young child undercount can and will have long-term consequences in North Carolina. It will have consequences in our health and education and for the prosperity of North Carolina's families, communities. A complete and accurate count of all of our state's children will help ensure adequate funding for programs such as the Supplemental Nutrition Assistance Program, known as SNAP, the National School Lunch Program, and the Children's Health Insurance Program. When children are missed in the census count, these programs that can help to support them and their families also stand to miss out on billions of dollars in funding that is based on the number of children who are counted. A complete and accurate count of children is also crucial for determining future need, so including funding for infrastructure and education programs and services. Good data and good numbers help local governments to meet the rapid growth of North Carolina's population. We all know that this is a great place to live, and more people are finding out every day. And as they move to North Carolina, we have to do more to make sure that all children are counted and that we can support that growth sustainably in the future. An accurate and complete count of our state's children will help to determine the best location for family resources like grocery stores and child care centers, and will also prevent underfunded and overcrowded schools. North Carolina has a variety of critical programs that help children and families, and all of those programs will need to be scaled up so that all children can have access. That begins with appropriate funding, which often relies on important population data that we glean from the census. So on behalf of North Carolina's Complete Count Commission and NC Child, I look forward to working with partners statewide to ensure that all children living in North Carolina, including newborn babies who may still be in the hospital on April 1st, 2020, are counted for our state and for their future health and their well-being. Thank you.